The kids are about to be out of school for the summer, and that means they'll be out and about playing, maybe even getting hurt. But a bleeding injury can happen anytime to anyone, and knowing what to do can save a life. Bridget is standing by now to ask a doctor all about it.
You may have heard the phrase "stop the bleed" before. It's something we hear a lot during Trauma Awareness Month because in worst case scenarios, stopping the bleeding can be the difference between life and death. Joining me this morning, Dr. Peter Pappas, the Trauma Medical Director at HCA Florida Lake Monroe Hospital. Thank you for joining us today.
Well, thank you, Bridget. It's a pleasure to be here.
You know, this is a time of year that gets sort of busy. School's about to get out. You know, everyone's out and about traveling more. We have the holidays coming up, Memorial Day holiday, lots of travel there. Accidents happen, and we talk a lot about CPR, but stopping the bleeding, trauma awareness, this is a very common issue that comes up.
Absolutely. It's very important, I think, for all of us. Oftentimes when we think about stopping the bleeding, we think about obviously very serious and extreme events, but no, it's really for every day. It's for work-related injuries. It's for injuries around the home. It's for accidents that happen on vacation, certainly car crashes. We have really national initiatives, and May is a very important month for us in our nation's trauma community. We celebrate not only EMS, we also celebrate our trauma survivors with Trauma Awareness Week, and it's National Stop the Bleed Month for all of May. What we really want to do is get people educated and trained on Stop the Bleed. And everyone, of course, thinks of the tourniquet. This is the standard tourniquet that you'll see a lot of times having EMS and law enforcement use. But there's also simple things like how to apply a bandage properly, how to pack a wound if it's deep, and finally, if you really need a tourniquet for an arm or a leg injury, how to use it appropriately.
Right. And what are some of the common things you see in the ER coming into the hospital when it comes to traumatic injuries?
We see a lot of cuts, a lot of lacerations. Believe it or not, one of the most common things we see where a tourniquet is used is when someone cuts their arm on glass. So something as simple as that, in terms of being able to control bleeding, reduce the risk of further bleeding, just reduces harm for the patient and gives us a better chance to get them taken care of.
And a lot of times it's what happens before they get to the hospital that's really the difference between life and death. So what are some of the things that we need to know in terms of helping someone who's losing a lot of blood?
Well, first of all, you want to try and just stop the bleed, period. Could be something as simple as taking a piece of cloth and pressing down on the wound, or using anything you have to try and control bleeding. With Stop the Bleed courses that are taught through all of our trauma centers here in Florida, as well as multiple public service agencies, you can learn how to appropriately apply a dressing, how to pack a wound, and then also how to use a tourniquet. Simple things like that can make a huge difference. And really, all of us in the trauma community, and certainly I would urge everyone to get online, go to stopthebleed.org, find a course. Many of our trauma centers, all of our trauma centers offer it, and really get trained and maybe even become a trainer yourself. The reason being, the most important thing we can teach people is to really not to be afraid, to stay calm. And knowledge is power. Knowing how to do it, knowing how to do a certain skill, mastering a skill can go a long way towards saving a life.
What are some rules of thumb we can take with us today when it comes to coming in contact with a situation like this, whether it be, you know, a situation that requires packing the wound versus using a tourniquet? Can you sort of break that down in a layman's term way?
It depends on really how bad it is. If you can stop it with just a dressing, good. If you need to apply some pressure or put something to pack the wound, that's the next step. If it's still bleeding, of course, then you'd go for a tourniquet. Most important thing, of course, is that, remember, you're not alone. Make sure someone's calling for help. Make sure someone's calling for 911. We have an incredible fire and EMS system, not only here in Central Florida, but statewide. We're national leaders when it comes to EMS here in Florida, and we should all feel very proud of that. They're going to be there. And in the meantime, there's things you can do that can help those paramedics do their job.
Okay, so you have a tourniquet, Dr. Pappas, but I'm at home, I don't have that, I don't have one of these fancy kits, someone's losing a lot of blood.
Sure.
What are some things that you could quickly grab that could work as a tourniquet or work as a way to pack a wound if you don't have dressings available?
Sure. Well, in an ideal world, of course, we do want to have approved and tested products. But in an extreme situation, if you've got nothing else, something as simple as a piece of cloth or fabric that you can put around like a tourniquet kit and twist it to try and again sort of stop the flow of bleeding or slow down the flow of bleeding. And then on top of that, again, pressure and compression. So there are things that can be done to temporarily slow bleeding down while you're calling 911.
Okay. And what about if the person's, losing consciousness, or what else can we do until help gets there?
Really compressing the wound again, doing whatever you can to sort of constrict that flow of blood with something, say if there's a wound injury to the arm, right? You want to be high above the artery to try and control bleeding from as close as possible to the source as you can. And really take that cloth or fabric and twist it and really hold it sort of like in a way that you'll sort of squeeze down. It's what a tourniquet does. It's not optimal. If you have nothing else, certainly that's what you'd go for. But time and again, we've seen that having good training, having the right equipment goes a long way.
All right, great information. Thank you so much for joining us this morning. And
You're welcome.
hopefully that will help someone in case they come into a situation like that to help save a life.
Well, thank you.
Thank you.